Today we're going to be talking about clinical pharmacy services. So clinical pharmacy services is the kind of next step to being more patient-centric than being product-focused that we typically are on the inpatient and outpatient retail setting. So if you think about, which is where the majority of our pharmacists end up working, and if you think about a traditional clinical, or a traditional role of a pharmacist, it's very product-centric. We're geared towards getting the right medication to the right patient, but we oftentimes do everything around that medication. Our system flows around the medication. On the inpatient side, we're all about distributing the medication throughout the hospital and making sure that everybody gets the medication in time. And then on the outpatient side of things, we're about making sure that we fill a prescription quickly, get the patient out of the store as quickly as possible, and sell as many prescriptions throughout the day. Our counters on the metric side of how successful we are in an outpatient setting is how many prescriptions do we sell today, and then the safety piece that comes with it is were there any medication errors or safety issues. So you hear a lot of it's very product centric. And so what we're going to talk about today is two different clinical concepts. One is clinical pharmacy. And clinical pharmacy is born out of the inpatient setting. It has been around for quite a while, and it's really gained steam, in the last 30 years, and in the last 10 years has become more and more predominant. And we'll talk more about that in about a week's time, talking about inpatient-centric clinical services. But we'll just briefly touch on that today. What we're going to focus more on is pharmaceutical care, which is the outpatient side of clinical pharmacy, and it is the concept around what drives different practice models that fall under MTM or medication therapy management. You should know that MTM stands for medication therapy management moving forward. We're going to use that abbreviation a lot. And it's good to understand medication therapy management is MTM. Okay, so think about inpatient clinical pharmacy, outpatient, and some would argue you can skew those lines, but outpatient pharmaceutical care. In pharmaceutical care, you have these practice models that fit under it called medication therapy management. We'll break it down a little bit more. And clinical pharmacy has multiple different kind of ways that it's put in place, but they all kind of fit under that overarching clinical pharmacy concept. Okay, so what I want to talk to you about is the umbrella of medication therapy management. And what I mean by that is medication therapy management has this overarching component to it that is multiple different clinical services. So think about MTM as the umbrella concept. When it first came out, MTM was really known as what we now call CMM, or Comprehensive Medication Management. So we're going to start on this side here and work our way to the other. And over here on the left-hand side is going to be your most clinically expansive services. And so when MTM first came out, it was known predominantly like comprehensive medication management. So CMM stands for comprehensive. I know it's not easy to read, but don't worry, we'll talk through it. And it'll be in your slides tomorrow, or I mean this week. So comprehensive medication management is what it sounds like. It is a comprehensive review of a patient care or patient's needs, a full assessment across all their medications, across all their chronic conditions. What healthcare needs does that patient have? And then we're going to follow that over time. So includes follow up over time. So it's not just a single meeting that you take do a review and then come back and say, okay, perfect, send this off to the prescriber and we're done. We'll talk about what that is next. A comprehensive medication management program would be much like a primary care provider. Now you have patients coming in to meet with you as the pharmacist. You review all of their healthcare needs, and you provide recommendations around what may need to change for their medication-related needs as well as their overall healthcare needs. I used to provide CMM services back in Minnesota, and I would meet with a patient probably, it was usually about 45 minutes to an hour. Half the time would often be spent on the medications. The other half of the time, diet, exercise, lifestyle changes to improve their overall health. And this meant we went through all of their medications, we went through all of their labs, we went through all of the things that they have going on with their overall health care, and we managed to, we tried to manage it the best we could. Okay, so the next service we're going to talk about after that is CMR. CMR is comprehensive medication again, and this is the R now stands for review. CMR is very similar to CMM, comprehensive medication. So you're doing all of the medications that the patient has. And it's a single review though, so no follow-up. That means you sit down with the patient, you run over all of their healthcare needs, but you're focused on finding any changes that are appropriate right now that you can make a recommendation directly to the prescriber, and that prescriber can then improve the medication prescribing pattern right then and there. And so it's really geared towards what can I help the patient with today by reviewing, doing a full assessment and taking a look at all of their medication-related needs in a patient-centric manner, but it's just not, doesn't include long-term follow-up. Okay? So next up we've got disease management, or DM. DM stands for disease management. And disease management now takes a patient and it tries to refocus. It focuses its efforts. So disease management is you take a patient that may have multiple conditions, but you're only providing comprehensive services for a single one of those conditions. A very common disease management clinic that we have out there today is a diabetes clinic. So a DM type 2, let's say, diabetes clinic. So you may have let's do a patient example. Patient 1 has diabetes, hypertension, and let's call it hyperlipidemia. Okay, so you've got a patient that comes in that may have medication-related needs with all three of these disease states, but the disease management clinic is going to focus on diabetes management. And the reason for that is because they're trying to be very focused on their efforts, which means they're going to be reviewing the patient's lab values, maybe managing ADRs, maybe changing doses of insulin. So all patient-related, and then maybe managing diet related to diabetes. So really focus on what can we do for the patient related to their diabetes needs. Now that doesn't mean they absolutely won't make a recommendation or take a look at their lipids or their hypertension, but that's secondary. Their focus is on diabetes. How can we make diabetes cared for the best possibly? So this comes with follow-up. You usually have long-term follow-up with these patients, and they'll be coming back to you on either a monthly, quarterly, or annual visit, depending on their needs. And you become the person that manages all of their diabetes-related needs. And you're working directly with a primary care provider or some other healthcare provider, the prescriber, that oftentimes gives you a lot of latitude to provide all the services necessary. Okay, so follow-up, comprehensive, and then this is comprehensive with no follow-up. Okay, now the next one we've got is a very targeted approach, and this is TMR. So this is even more targeted than disease management. Now we're looking at a single medication. and there is typically no follow-up with this. When I say no follow-up, what I mean is you may give the patient a recommendation, you may send a letter to the prescriber with a recommendation, but you're not going to likely meet with the patient again over this medication. So let's think about an example of this. We can think about, there's a whole bunch of them that come across, but one example might be a benzodiazepine with somebody that is over the age of 65. So a patient that has a potential for a falls risk on a medication that could cause a fall. Now, does that mean the patient shouldn't be on that medication? Not necessarily, and that's the question, and that's where a TMR comes in. The pharmacist would do some clinical evaluation with the patient, determine is it appropriate for the patient to continue with their benzodiazepine, and then makes a recommendation off of it. And so this will be a targeted medication review, only looking at that single medication, and then maybe making a recommendation to switch, keep it the same, etc. So no follow-up, but you'll do the complete review of the appropriateness, and then send your recommendation off, and then typically that's all that's associated with the TMR. So each one of these are your 4 primary, and TMR is targeted medication review. These are the 4 primary MTM-like services. Now, I have some friends that work in retail that would argue that medication counseling should fit in here as well. And maybe it should. But I think the only way that medication counseling fits in the realm of clinical pharmacy services in the outpatient setting and under MTM is if it's done really well. If it's done in a patient-centric manner, where that we're not focused on a single product and providing product-centric recommendations, but rather we're providing counseling to improve the patient's overall health care. And so, yes, we're focused on that medication similar to like a TMR, but we're doing it in a manner that is looking at providing additional education and services to the patient around disease management with the medication being dispensed. You know, that's like we talk about in class, how if you're dispensing metformin, you can either dispense on a very product-centric focused, which would not fit under this MTM component, or you can provide it in a very patient-centric focused, which would fit this model, which would fit what we're trying to do here, and it would be kind of a mix between medication counseling and TMR to some degree. I completely agree that medication counseling and some of the dispensing services that are done can fall under MTM, but you have to do it in the right way. Now, you notice we haven't talked at all about clinical pharmacy services. And if we were to include clinical pharmacy services under MTM, even though it's an inpatient side of things, I like to kind of just draw this up because I think it fits well right in here. Okay, so think of it as if it fell into that spot of the umbrella. So this is in hospital, clinical pharmacy services. Now, why it typically falls in between CMR and disease management can be thought of in this sense. Okay, so when a patient ends up in the hospital, they end up usually in a single department. They end up in a single unit, which is, let's say they came in for a heart attack, so they end up in the cardiac unit. A clinical pharmacist can be found in the cardiac unit, decentralized, which we'll talk about what that means, and reviewing all patient care related needs for patients that are found in that individual unit. And so those clinical pharmacy services are really going to be looking at what medications the patient has been prescribed for post-MI management and managing their cardiac-related needs predominantly. Now, with that being said, that doesn't mean that is the only thing they manage. But let's think about it as in the disease management sense, they're looking at cardiac specific first, okay? And they will follow up short term. While the patient's in the hospital, they're following up. So there's pseudo follow-up here. But realistically, most often what they're doing is, even though they may be cardiac centric, they'll do a comprehensive review, making it more like a CMR. So in the inpatient setting, you kind of have this single review, one review, with limited follow-up, and even though it's unit focused, like cardiac focused, it is a comprehensive review without follow-up, which makes it more like a comprehensive medication review. And what they're really focusing on is the short-term needs. Are the patients getting all the medications they're supposed to have post-MI, let's say? And they've got all the meds on that list, okay? Are they getting discharged on those meds, and they're gonna be able to get them at their outpatient pharmacy when they get out of the hospital? So they're focused really on making sure the patient gets all the medications they need in the short term. And they'll also be looking at, okay, what else are we using to make sure there's no drug-drug interactions with any of the other conditions or prescriptions. And so it's this comprehensive approach with limited follow-up, right in between disease management and comprehensive medication review. But we'll spend more time on this and how it's done with decentralized pharmacy versus centralized pharmacy. And then is it done with the patient contact, or is it predominantly with reviews of charts and notes and discussions with other healthcare providers. But that'll be coming up in class. That's just an introduction to some clinical pharmacy services and some of the terms we'll be talking about this week so that you'll have a better handle on it. All right. I will see you in class. Thank you much.